Good morning, everyone. Happy Friday. It's time for our Henry County Health Center FYI. And this morning, we are joined by Natalie Gent, the registered dietitian at the Henry County Health Center. Good morning, Natalie.
Good morning, Katie. Thanks for having me.
I'm so glad to meet you. I know the Henry County Health Center is welcoming you as the new registered dietitian. So tell us a little bit about yourself, your education, background, past experience, all that good stuff.
Sure. So I became a registered dietitian and completed my undergraduate degree at Iowa State University. And so that is a 4-year program, and I majored in dietetics. And then from there, I had to complete an accredited internship where I did so at the University of Iowa Hospital and Clinics. And that was a 10-month internship where I kind of rotated throughout the hospital and got a variety of clinical and food service experiences. And then I stayed on at the University of Iowa, and I covered the cardiology floor and the general medicine floor as a clinical dietitian, so I got some good experience there. And then I went to Hy-Vee, and I was the retail dietitian at the store located in Iowa City. And there I did a lot of group cooking classes. I did some freezer meal workshops, some store tours where we kind of walk the aisles and look at nutrition labels. And I also did some one-on-one counseling there. So I kind of have a variety of the clinical and then that retail experience from both places I've worked at.
Yeah, that sounds like a really well-rounded kind of experience in the world of a dietitian and the different opportunities that you could have.
Absolutely.
So, how does that kind of translate to your role as a registered dietitian now at the health center? You want to talk about what you're doing now?
Sure. So in this role at Henry County, I have the opportunity to participate in both inpatient services and outpatient, which is really cool. So inpatient, I will participate in the care conferences for our skilled patients. And then for the rest of the patients, I'll check in to see how they've been eating, if there's any weight loss concern, or if they need any dietary supplements. Sometimes I'll give an educational refresher, or if they're interested in coming to see an outpatient, I will set up a referral for that. And then for outpatient, which does take up the majority of my time, we focus a lot on diabetes education. So most of my patients have diabetes. And then I also see people for weight loss. I do presentations for the cardiac rehab population. And then I've seen a couple heart healthy patients as well. So those are just one-on-one nutrition counseling based on whatever the client's needs are.
Wow, you do it all, Natalie. Talk then about the benefits to seeing a registered dietitian.
Sure. So really, this is beneficial to kind of understand the big picture, especially if you have a certain disease state like diabetes, which we see a lot. Understanding how carbohydrates really affect your overall health and the care of your diabetes, and how diet and exercise can help you manage your diabetes and get your A1C lowered. So really pairing the diet, the exercise with medication if that is indicated as well for an overall benefit of the diabetes care. And then especially for if people wanted to come in for weight loss or a heart healthy diet, just really understanding what foods to pair with what and the timing of foods to kind of help them with their overall goals.
Can anybody use your services, and do they need insurance, or could you speak on that a little bit?
Absolutely. So anyone can see a dietitian. Here at Henry Health Center, you will need to get a referral. So you can get that from your doctor, or if you want to contact me first, I can reach out to your physician and get a referral for you to come see me. And really, again, anyone, if you want to come in just to talk about healthy eating, that's fine. If you have a disease state that you need more education on, that's totally fine too. So we see a wide variety of patients, and we do always check your insurance prior to you coming in, so you'll know if it's covered or if there is any out-of-pocket fees as well.
So if somebody is listening and maybe they're interested in getting a referral and getting in to see you, how can they schedule appointments, or how can they reach you?
Sure. So you guys can reach me at our phone number goes directly to my office or the Diabetes Education Center, and that is 319-385-6143.
Very good. I love the focus on healthy eating and healthy lifestyle. It's so important. And really, food can be medicine, right? So
absolutely.
So it's been a pleasure, Natalie, for having you on this morning to talk about your role as the registered dietitian here at the Henry County Health Center. Thanks so much.
Thank you.